Breaking news when it happens. News Radio 1080 KRLD.
Good morning. It is 6:50 as the Thursday morning news continues. And each Thursday we check in for an update from Stephen Love at the Dallas-Fort Worth Hospital Council. And he joins us now. Good morning, sir.
Good morning, Chris. Hope you're doing well.
You as well. Want to get an update on how much the numbers have gone up in the last week. But first, the most important development, this new Delta Plus variant. We were talking a little while ago. Several cases confirmed down in Houston. Have we seen it here? And what is the distinction between Delta and Delta Plus?
You know, I think it's a couple of things. One, to answer your question, I have not heard any confirmation of it here. But if it's in Houston, it's a good chance it'll be here. It's my understanding it replicates quicker and also it's more potent. That's what I understand from the Delta Plus.
Stephen, we're hearing 48 of the 50 states, the numbers are up. More people, more hospitalizations, a lot of people in intensive care, especially young people. What can you tell us about the people who are winding up in the hospital? They are almost uniformly unvaccinated, correct?
Yes, the majority of the people, and we're up to 657 patients. We've had a 70% increase in hospitalizations in the last 2 weeks. The average age continues to decrease, but you're correct, Mike. The majority are unvaccinated.
As you mentioned, 657 people in our area in the hospital this morning with COVID. That number, when you and I spoke a week ago, was 450. And now school, the start is right around the corner. That's really something to consider here.
It really is. When I talk to the epidemiologists and I talk to the infectious disease physicians, they're really concerned about August with kids going back to school, this Delta variant, and now we've got this Delta, what I call super variant coming through. Very concerned August is going to be a very tough month. The other thing you have to realize, even though 657 is not as many as we had in mid-January, we're running about 14 to 15% of every patient in ICU has COVID.
Why are younger people so much more reluctant, it seems, to get that vaccine?
A couple of things. Many of the women of childbearing years are very concerned about, will this in any way, especially if I'm pregnant, cause harm to my baby? And if I'm thinking about getting pregnant, is it going to do something to me that would cause some type of birth defect? All the infectious disease doctors say no. The other reason, I think many young people feel like, oh, this really hit the elderly early on. I may get it, but it'll be kind of like the flu. I'll get my vaccination sometime, but I'm in no hurry.
If we don't get these vax numbers up, what's this fall and winter going to look like?
You know, and I talk to the physicians, they're very concerned. As it gets cooler and as we, are more indoors, we've got 50% of the people unvaccinated. We've got this Delta variant. They're very concerned that we could have a surge, maybe not to the extent we did in January, but we're already seeing big spikes.
All right, Stephen, thank you so much. As always, we appreciate the time. That is Stephen Love with us on KRLD. It's always interesting information from him, as we are hearing with this new Delta Plus variant that has popped up in Houston.
And I know people don't want to be preached to about these vaccinations, but the reality, Mike, we should not be in this situation right now. Up next, traffic and weather together on the 8s, and then you could have some extra